Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf Lodi, and this episode is everything you need to know about lichen sclerosis. But before I get into it, I want to make a few things very clear. One is that this is not medical advice. If you have any questions about anything at all, your health, make sure you go see your friendly neighborhood healthcare provider. And if you have any questions about your religion, make sure you go see your neighborhood religious leader. This is the Muslim Sex Podcast because I just happen to be a Muslim woman that talks about sex. So today I'm going to be talking about something called lichen sclerosis. So I don't know if you've heard of it before, but it is something that can cause a lot of pain and itching and, really burning. There can be pain with intercourse, and it is a condition that affects the vulva. And if you've never heard of it, you're going to hear of it now because it's something that's really important. And so just to give you a little bit of background information on this, and then I'm going to tell you about a patient story that I had. And actually, I've had like a few patients now that have had lichen sclerosis. So lichen sclerosis is an autoimmune driven chronic inflammation of the vulva, and that usually thins and scars the genital skin. So its lifetime prevalence, meaning like how often does it occur, is about, we think about 1 in 70 vulva owners. And that's why raising this awareness is super important, because what can happen is that, so I'll tell you of a story. I just had a patient, so I was in the clinic, and not in my own clinic, but in a different clinic. And a patient came in that was complaining of recurrent vaginal itching. And she said, she'd been treated so many times for candida or yeast, and it just wasn't going away. She just keeps having this itching. And she said, I was just swabbed and everything came back negative, but I still have this irritation. So I asked, the patient if I could examine her, and I examined her. And then, my medical assistant said to me, she's like, "Oh, why do you need to examine her? She was just given a swab and everything came out negative." And I said, "Because you never know what she has." And I was right, because when I went to examine her, I noted that her labia minora had all of these white little patches on them. It wasn't yeast, but it looked like there had been chronic irritation. She had been itching for a long time, and it looks like, and she actually said that she had been itching, for over the course of a few months. And so the area where she was itching had become pale and white and really irritated. So what I did for her is I went ahead and did a biopsy. So how do we do that? So typically, anytime somebody comes in with, let's say if it's itching, or if the vulva seems like the color is changing, like for her, in her labia minora, the color had actually changed. It had gone from, like this pinkish color, which is like normal, to normal color, I would say, is probably like tan, pinkish. So hers actually went to white, like the color of paper. And, it was very obvious where the skin changes were occurring. And they were occurring on both sides of her labia, and also at the bottom part of her labia, what we call the introitus. And so what I went ahead and did is I took a biopsy. So how do you take a biopsy? Basically, we numb the area, and we take a little piece of tissue about the size of like the tip of a pencil off, and then we send it to pathology. So I don't have those results yet, but I'm thinking it's going to come back as lichen sclerosis. And so that's why I think it's so important that, and for practitioners as well, right? So if you have somebody that is complaining of recurrent itching, and it doesn't, when you do the exam, it doesn't look like yeast, it doesn't look like any type of inflammatory reaction, and of course, if you see skin changes, you absolutely need to do a biopsy. And so that's what I did for her. And, it's going to make a real big difference as to how we manage her, right? Based on what it is that she has. So a little bit about lichen sclerosis. Like I mentioned, the lifetime prevalence is about 1 in 70 vulva owners. And really, it's important that as we see more and more of it, that we raise awareness around this condition, so that women can get treated much earlier. And it usually affects the vulva. It does not go into the vagina, and it can sometimes also surround the anus. And so some of the symptoms that women will notice is that, they may have intense itching that's worse at night. You can have burning, you can have tearing or pain with intercourse. You can also notice some decreased clitoral sensation and changes to the vulvar anatomy. And I'll tell you that, so I had another patient that came to me, and she told me that, every time she urinated, it burned. And so in the back of my mind, I was like, okay. And she said, she had these urinary tests, and everything every time was coming out negative, and she just couldn't figure out why it would always burn when she peed. So I went ahead and I, did an exam like I always do, and I noted that she also had these white lesions, white patches on her vulva. And I took a biopsy of that as well. And I noted it was lichen sclerosis. And so that's why nothing ever came up on her culture for her urine exam, because it wasn't a urinary issue. It wasn't, she didn't have a bladder infection. What was happening is that when she was urinating, because the urine is acidic, it would hit that white patch, and that would cause the burning. And that's what she was noticing. So that even though it seemed like it burned only when she urinated, it was because it was hitting the area of the skin of the vulva that was irritated, and that had that lichen sclerosis. And I'll tell you what happened. Well, this lichen sclerosis had been going on for years, she said, and nobody had diagnosed her with it, but she continued to have this pain. And because this was a chronic condition, she developed secondary vaginismus. And so you remember, we've talked about vaginismus so much on this podcast, but I'm sure you remember that, it is, vaginismus is where you have this involuntary contraction of the muscles around the vagina. And so because she was experiencing this pain, right, every time she urinated, and what was happening due to the lichen sclerosis, I'm going to get into this as well, is that sometimes you can have narrowing of the opening of the vagina. And so she started to have this narrowing. And so every time she and her partner wanted to have penetrative intercourse, it was painful for her, and she would feel as if she was tearing and ripping down below. And the reason why that's important is that because she's experiencing pain, so now she's developing this fear, right? So remember with vaginismus is that you have this fear of pain with penetration. So now, because she was experiencing this pain every time she had penetration, the muscles around the vagina would start to tighten up. So she would explain to me that it was as if her husband was hitting a wall, and which he was, because those muscles were so tight that they couldn't, they couldn't have penetrative sex. And so it was really, really painful for her. So this is super important, that this was a woman that never had any vaginismus prior to this, right? And so all of a sudden she starts to develop this lichen sclerosis, and I'll get into who we generally see lichen sclerosis in. But here's this woman that starts to develop this lichen sclerosis, who starts to experience pain with every time she urinates, and then now she develops a secondary condition of vaginismus. So now, because she's always anticipating pain with penetration, because she's starting to get narrowing of the vagina due to this lichen sclerosis, she develops a secondary vaginismus. And now, she's afraid to have intercourse. She can't have intercourse with her partner. And she's really, really upset about the whole thing. So anyways, I ended up treating her. I treated her with the medication. And I'm going to talk about all of this, but I ended up treating her with the steroids that she needed. And I told her, this is a lifelong condition and she's going to need to use this steroid for like the rest of her life. And then she also started to go to a pelvic floor therapist. Remember, anytime we have some type of sexual dysfunction, you can't treat it in like a silo, like by yourself. You know what I'm saying? So you have to have kind of a 3-factor approach. So what we usually do is, we have the sex med doc, we have this pelvic floor therapist, we have this sex therapist. So she needed all 3, because remember, she has this lichen sclerosis. It's causing all this mental burden on her, because now she's afraid to have sex. Now she's thinking something's wrong with her, that she's broken. She doesn't know why she can't have sex anymore. It just, everything hurts, and she feels like she's always tearing and ripping, which she was, by the way. And so she wasn't imagining it. She was tearing. And that was all due to the scar tissue that was forming from that lichen sclerosis. And so once I saw her, I gave her the steroids that she needed. She started seeing a pelvic floor therapist who worked with her with dilators. And then also she was going to a sex therapist who was working with her, about her thoughts and her fear of this penetration. So she needed this multimodal, treatment plan because of what was going on and how it was affecting like her whole life, really. So remember, with this lichen sclerosis, you can have burning, you can have tearing, you can have pain with intercourse, you can have decreased clitoral sensation and changes to the vulvar anatomy. Sometimes what I noticed, and this is typically the way it shows up, is that you'll see these smooth white plaques forming around the vulva, sometimes even around the anus. And about 10% of the people will experience this in their non-vulvar regions. And it's more likely to affect women than men. And this condition can affect pre-adolescent women, perimenopausal women, and postmenopausal women. And what can happen is that the labia can shrink or fuse together. So with her, what she had is that the vaginal opening was starting to get scarred, and so that hole was starting to become smaller and smaller. And what can also happen is that there can be pain or tearing with penetration. That's exactly what was happening with her. The clitoral hood can also be buried. And so what can happen is that the hood of the clitoris can fuse together, right, and cover that clitoris so that the person no longer is able to experience like an orgasm, or they have like a muted orgasm because the clitoris is totally covered. And so what they think is, the cause of this. So why does this even happen, right? That's what we're trying to figure out, is why did this happen? And so it appears that lichen sclerosis is multifactorial. It can involve genetics, autoimmunity, hormonal status, mechanical and urinary irritation, can really all contribute to this lichen sclerosis forming. Postmenopausal estrogen decline, frequent toileting trauma and positive family history are common. So, but that doesn't always have to be the case, right? Like some women can just develop it and we're not sure. And they say that it has a lot to do with autoimmune disorders. So, perhaps if they have one autoimmune disorder, they can have another one. And this condition can appear as a result of white blood cells accumulating in the vulvar skin, releasing inflammatory chemicals. So what happens is that they think the thought is that these white blood cells come in and they release these inflammatory chemicals, right? Something that causes inflammation in the skin. And due to that inflammation, it causes like a chronic irritation. And that's why you get this white plaques forming. And that chronic inflammation causes the skin to become very thin. It becomes paper thin. And you can have that narrowing of the vagina, but you can also have those tears that we know are common in lichen sclerosis. And so, like I mentioned before, the thought is that there is some type of autoimmune overlap, and that's seen in about 20% of the patients that can have also, let's say thyroid disease or alopecia or pernicious anemia or any one of those things. There is that lichen sclerosis can also have what we've seen is a lifetime risk of vulvar squamous cell carcinoma, and that is about 3 to 7%. So the important thing to remember is that lichen sclerosis can go into develop into squamous cell carcinoma, but it doesn't happen all the time. And really, to keep this condition from getting worse and progressing, you really need to be on this maintenance dose of steroids to help prevent that skin condition from turning into a cancer. And that's why it's super important that if you have somebody that comes in with like this vulvar itching and irritation and pain with sex and all of this stuff, and you take a look at the vulva and you notice that that skin is starting to change color, right? I always remember this, is that, after talking to dermatologists, anytime you use that ABCD, right? What is that? Like asymmetry, border, color. Basically, if anything looks abnormal, right? If anything is changing in the skin, you need to always get a biopsy to make sure it's nothing horrible. And in this case, when we're talking about the vulva, you want to make sure that it isn't vulvar cancer. And that's always kind of what goes through my head. Like, if I'm seeing skin changes, I don't want to miss a vulvar cancer. So I always will biopsy. And remember that this changing into vulvar squamous cell carcinoma is driven by chronic inflammation and hyperplasia in older age. So it's not like it's going to happen to everyone. You just have to make sure that if you start to notice skin changes in the vulvar region, to make sure that you go and get that evaluated and get a biopsy done, because you want to make sure that it isn't any type of cancer. Now, an experienced eye could definitely, probably diagnose lichen sclerosis without even a biopsy, but I always will biopsy because I don't want to miss something. And, especially if I know that it can go to, squamous cell carcinoma, I want to make sure squamous cell cancer, right? I want to make sure that I don't miss anything. And if these lesions are atypical, and after 3 months of treatment, they're still not getting better, you definitely have to wonder, make sure that it's not cancer that this patient may have. So the mainstay of treatment for lichen sclerosis is a medication that we call clobetasol, and that is a high potent topical corticosteroid. So it's a steroid that you would put on the lesions. You always want to make sure that, so I have a friend, Dr. Jill Kraft, and she, and along with Dr. Goldstein, both Andrew and Erwin Goldstein, wrote a book called When Sex Hurts. And in that book, they mention, how they treat lichen sclerosis. So, one of the tips that they give is to apply clobetasol cream. And what you want to do is you want to first just soak that area in some water, about 15 minutes, to soften up that skin. Because what can happen with this is lichen sclerosis, the skin can become, even though it is thin, it can become hard, and it can, not, because it has this chronic inflammation going on, it may not absorb the medication, the steroid, as well as it could. So what you want to do is you want to soak the area for about 15 minutes. before you apply the ointment. So you don't want to use a cream, you want to use the ointment. And the reason for that is that the ointment absorbs a little bit better. And so you want to soak the skin, you want to apply the ointment, and you want to rub it in. And so you want to apply the steroid only to the area that's affected, and usually about a pea-sized amount. They say about zero point 0.5 milligrams. So it's about the size of a pea, so maybe like about this much, right? And you're rubbing it into the area that is affected. You want to rub in the ointment for about 2 minutes. So 2 minutes is a super long time, right? So, sometimes you rub something in and you're like, okay, that's enough, but that's only a few seconds. You want to really make sure that the ointment gets into the skin, and you rub it in for 2 minutes. And then what you do is you use that medication for about 6 weeks. Every single day. And after that, you use it twice a day for the rest of your life. I mean, sorry, the twice a week for the rest of your life. Because what you want to do is you want to maintain kind of what you've helped the skin achieve, which is to get better, right? And so if you stop, and that is what actually happens for a lot of people, because physicians don't know a lot of times, if they haven't done sex med or they haven't read these books, they don't know that you're supposed to actually keep the treatment going for the rest of their lives, for the patient's life, right? So, and that's why a lot of patients will have remission and their lichen sclerosis will not be treated, is because they were given the medication, told to use it, let's say, maybe every single week for 6 weeks. And after that, they were told to stop and discontinue it. And that's where the problem comes in. You actually have to maintain that treatment for twice a week for the rest of their lives, so that the condition doesn't keep coming back. They don't keep getting a flare, so the skin doesn't keep scarring up, so that they have all these issues, right? So that's why that's important. Even so, if there is scarring or narrowing of the introitus, there are some physicians that will do surgery. So they will break up what they'll do is they'll break up the skin where the scar tissue is formed, and also for example, if the clitoris is covered up, the hood has covered up the clitoris, so that it can't, so the woman can't experience pleasure anymore due to lichen sclerosis. What will happen is, if you go to a well-trained surgeon, they can also get rid of those adhesions, right? Like all of that scar tissue, they can get rid of that, so that, they can uncover the clitoris to do clitoral lysis of adhesions, right? So where they take down the scar tissue. Or you can also, if the vagina if that opening has become more narrow due to the scarring from this lichen sclerosis, they can also take down that scarring. And then what Dr. Goldstein and Dr. Jill Kraft recommend is to apply the clobetasol cream, the steroid cream, right on the area where that was where those adhesions were taken down, so that they don't reform. And they say that sometimes it can take a little bit longer to heal because you're putting those steroids on, but that you need to do that so that the scar tissue doesn't form again like it was, right? And of course, you always need to use vaginal dilators. So like I mentioned before, you want to have a pelvic therapist on board, because these patients will need to use a pelvic dilator, so that they can stretch out that tissue, right? And so that they don't tear. I mean, that's really the key there, is you definitely don't want a patient tearing, because of course then, they would have that fear, right? And then develop that secondary vaginismus that we were talking about with my patient that developed that. So that's typically the treatment there. And, hopefully a lot of patients don't need surgery, but there are some that do, right? Because if that lichen sclerosis has been going on for a long time and they just came in to see you now, that opening to the vagina might be very, very narrow, right? It might be super narrow, so that they're not able to have penetrative intercourse at all. And that's why they would need that surgery. And they would need to work with somebody with the vaginal dilators. And of course, they would need sex therapy with them as well. So that's why that is super important. About 70% of women have reached remission by 3 months with correct use of the steroids. But remember, they need to continue to use those medications for the rest of their life, so that that scarring doesn't continue to form. because we know that it's caused by an autoimmune response, we need to decrease that immune response. And of course, the way that we decrease any immune response is by using steroids. So that's why we use. That's why the mainstay of lichen sclerosis is clobetasol, which is the steroid that's used, the steroid ointment treatment that is used for lichen sclerosis. Early regular clobetasol is really a game changer for these patients. And of course, you want to remain symptom free forever. And also, surveillance for this is going to be key. So, just because you get treated, right, and all of a sudden you feel better, I see this in patients all the time. All of a sudden they get better, then they don't follow up, and then all of a sudden they get like a relapse and they don't know what happened, but they haven't followed up with the doctor in like a year. So, what is super important is that if you have this, make sure you go see your doctor. Please go see them if it's even like once a year or once every 6 months, just to make sure that you aren't trying to redevelop this and that, it stays in remission and that you are staying true to your pelvic floor therapy exercises and also seeing a sex therapist who can help you throughout this whole condition and navigate it. So, those are really the important things about lichen sclerosis. So just remember, if I were to tell you to remember a few things about lichen sclerosis, what I want you to remember is that it is an immune-driven chronic inflammation that thins and scars the genital skin, right? So if you think like, hey, you know what, I have this thing, but it's going to go away, I'm going to get better, it's going to be fine. No, that's not going to happen. You really need to get it treated. You need to follow up. You need to make your appointments with your doctor. And sometimes, like I said, you may need a biopsy to confirm that this is the diagnosis, but you never want to just let things go, right? And if you are having this chronic itching, if you're having this irritation, now you're starting to develop this pain with sex, you want to make sure that you know what that's from and get treated, okay? And we know that this can also cause tight pelvic floor muscles. So, a lot of things can happen during this time. So it's super important that if you are not feeling well, if you have these skin changes in your vulva, that you go and get it looked at and assessed and treated. And, I always want to make sure that I leave with hope for patients that are suffering. So it's important that if you are not, that you go and get help because you don't want it to. Remember, lichen sclerosis doesn't mean that all of them do, but it can go on to vulvar squamous cell cancer. And so you want to make sure that you never get to that point, right? And so always, if you're having this chronic itch, if you're having pain or something's going on with the vulva, make sure you go and get assessed so that, if you need a biopsy, you get a biopsy. Otherwise, you go and get treatment with steroids, the pelvic floor therapy, and maybe even a sex therapist, especially if it's chronic. So if you are having issues, if you're having chronic itch, if you're having pain, burning with urination, if you notice all of a sudden you never had vaginismus, but all of a sudden you're starting to develop it, you want to make sure you go and get checked out. You want to make sure I always say that you should know your vulvar anatomy. You should know your anatomy, right? Know what is normal, know what has been going on all these years. So take out a mirror, take a look, see what's going on, especially if you have a chronic itch, pain with intercourse, any one of those things, pain with insertion of like a tampon or something like that. You want to make sure that you take a look, see what's going on. And obviously you may not be able to diagnose what's going on, but at least you can then see, where is this itch coming from? Where is this pain coming from? And then go and make an appointment with your gynecologist or your healthcare provider so that they can take a look and assess. And then if you need a biopsy, they do a biopsy to confirm the diagnosis. So all of those things are super important, okay? So I want to make sure that you take care of your health and get that taken a look at. And well, again, I am done here, and it's been real and really intimate, and it's not meant to be any type of medical advice. So if you have any questions, make sure you go see your doctor. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.